If you are one of the millions of people who struggle with hay fever, then you're probably desperately scouring YouTube to find answers about how to manage it and prevent it. Well, you've come to the right place. I'm going to give you those answers, and keep watching right to the end because I'm going to show you how to use a steroid nasal spray, because chances are you're not doing it right. Hay fever is so common that it's estimated around 10 to 30% of the global population suffers with it. And if you don't have proper medication and proper management, I'm sure you've discovered it can be really debilitating. You're more at risk of getting hay fever if you've got a family history of hay fever, or if you're already suffering with asthma and eczema. And for some people it's because they live or work in an environment with lots of what we call allergens. So they're things that can create an allergic reaction, such as dust mites. So hay fever symptoms typically begin in springtime when the trees are releasing their pollen, but it can go all the way through until autumn when there's more weed and grass pollen around. And it does really vary on where you live and what the weather conditions are. So one thing you should definitely do is make sure you're checking the pollen count in your local area. So let's start with the basics. Well, the name's pretty silly because it's actually got nothing to do with hay, nor has it got anything to do with fevers. We call it allergic rhinitis because it is an allergy to pollen from the trees, the weeds and the grass. So an allergic reaction, the body is creating a response like it's fighting an infection to something that's actually harmless. And so the body releases histamine, and it's the histamine that causes the symptoms like the itching, the watery eyes and the sneezing. Other symptoms can include headache, loss of smell, earache. If you've also got asthma, you might notice that your chest feels tight. You might be more wheezy than normal and a bit short of breath. And actually a lot of people also struggle with really significant tiredness. So much so that studies have shown that people who do exams during hay fever season do 5 to 10% less well. So it really affects your concentration as well. And I think that just shows how important it is to properly get on top of it. So symptoms can be really quite similar to a cold, but a cold typically lasts 1 or maybe 2 weeks, whereas symptoms of hay fever can last weeks or even months. So there's lots of medications available over the counter in the UK, straight from the pharmacy, to help with your hay fever. You can get antihistamines and they help relieve the sneezing, the itching and the eye watering. And it used to be that you had to get strong antihistamines as a prescription from your GP. But actually now you can still get those straight from the pharmacy, which is even easier. You can get eye drops which have got antihistamines as well if it's your eyes that are really giving you the problem. You can also get nasal decongestants, but make sure you want to use them for about a week, otherwise when you stop it gets worse. You can get a saline nasal spray just to help keep the nose well moisturised. But I think the best treatment you can get from the pharmacy is a steroid nasal spray. And what's really important to know is they do take usually a couple of weeks to work, even sometimes longer. So if you're watching this, then get one now and start using it. But next year, start a little bit earlier because you can actually prevent the symptoms from getting worse if you start using that steroid nasal spray a few weeks before you expect the hay fever season to kick in for you. Now, for about 10% of people, these easily available over-the-counter treatments still don't work. And it used to be that in GP practices, we would give a steroid injection called Kenalog. But actually, this is no longer recommended because it's thought that the risks outweigh the benefits. It is still available privately, so if it's something you still want, you may be able to pay for it. But what's more likely is if you go and speak to your clinician at the GP surgery, they potentially could refer you on for some immunotherapy from secondary care hospital specialists. So here are my top hay fever hacks to help you alleviate those symptoms. Avoid drying clothes outside. If you can, buy a pollen filter for your car and make sure that air conditioning is turned to recirculate the air. Try to keep windows and doors closed, especially on high pollen count days. Wash your hands and face often, or even better, change out of your clothes and have a shower when you get in. Wear a hat. That is really helpful to stop the pollen from sticking in your hair. Get some sunglasses, wrap around sunglasses if you can, they're best to protect your eyes. And a really good tip is get some Vaseline and pop this around the edge of your nostrils, and that helps trap the pollen before it enters the nose. Dust with a damp cloth and vacuum regularly. Okay, now I'd like to show you how to properly use a nasal spray. I've got some Beckinase, which is a steroid spray. I'll leave a link in the description if you want to buy this one and try it. So what you need to do first of all is blow your nose before you start, remove the cap, and if you've not used it before, you need to prime it, or if you've not used it for a while. So point it away from you, give it a spray or two until you see that fine mist coming through. And then what you want to do is use the opposite hand to the nostril you're aiming for. So I'm using my right hand and I'll aim towards my left nostril. You need to tilt your head slightly forward and aim it towards the edge of your face here. Some manufacturers say try and use your other hand to block the other nostril like this. So you could do it like that. So have a read depending on what your instructions say. And then really importantly, as you spray, breathe in gently. So if you kind of go like that, it'll just shoot to the back of your throat. It won't taste very nice and it won't work because it won't have got to the right place. So a nice gentle breath in as you spray down, pointing towards the edge of your face, and then breathe out through your mouth and repeat as necessary. I hope you found that really useful. So just remember, with the correct preventative measures and treatment, hopefully you can enjoy the beautiful outdoors as the weather gets warmer. Have a look at the rest of my videos on my YouTube channel. There's loads of other great videos I hope you'll find really useful.